Hi. My name's John Sexton. I'm the NP student. Nice to meet you.
Nice to meet you too.
And you are Thu, correct?
Yes.
Okay. So I know the medical assistant kind of grabbed your vitals on the way in, and everything looks good. Like your heart rate's 80 beats per minute, blood pressure's 120 over 80, respiration rate was 16, your temperature was 98.5 degrees Fahrenheit, and you're not having any pain or anything like that, correct? Okay. So tell me what brings you in today.
Just for an annual checkup.
Okay. And then with the annual checkups, I just kind of like to get a general idea of what's going on with your health. So I started off with some very broad questions. It just helps me kind of paint an overall picture. Can you tell me your age?
27.
Okay. And then how much do you weigh?
104
104.
pounds.
Okay. How tall are you about?
5 feet.
Okay. And then do you have any past medical history that you're aware of?
No.
Okay. Do you have any problems with like your vision?
I wear glasses or
Glasses?
contact lens.
Okay. When was your last vision appointment?
About 6 months ago.
6 months. Have you had any like dental procedures or dental history?
Just some dental fillings.
Okay. And when was your last dental visit?
Actually, a month ago.
1 month. Very good. Any past surgical history that you're aware of?
No, just some tooth fillings.
Okay. Do you take any prescription medications?
No.
Anything over the counter? Any herbal supplements?
No.
Okay, good. Do you have any allergies that you're aware of?
No.
In regards to immunizations, are you up to date on all your immunizations or vaccines?
Yes.
Are you also up to date on your flu shot?
Yes.
Okay, you received it for this year, correct? Okay, perfect. And then I like to ask about family history too, like for genetic purposes, but if you have any children or siblings or parents or grandparents with a medical history that you're aware of?
Well, my dad is a long-term smoker.
Okay.
My mom and my brother are healthy.
Okay.
And my grandparents passed away a long time ago, so I don't really know their history.
Okay. Very good. And like I said, some of these questions are very broad, but it helps paint a good picture about everything. So what do you do for work?
I'm a nurse.
Nurse? Okay. And then what is your highest education level?
I'm working on my master's.
Master's. So do you go to school as a,
Full-time.
very good. And then do you work full-time as a nurse too, or?
Yes.
Oh, wow. That is impressive. As far as your living arrangements, do you have adequate housing?
Yes, I live with my parents.
Okay. And do you have health insurance?
Yes.
Good. And you have adequate health resources and everything? All right. I know you said you're a nurse, but is there any type of like environmental exposures such as chemicals or needles that
Yeah,
you can think of? Your
needles,
just needles,
but
but not pricking yourself or anything like
yeah,
that?
no.
Okay. Are you sexually active?
Yes.
Okay. With one or more partners?
One.
One? Okay. Is your partner a male or female?
Yeah.
Okay. Do you use protection
Yes.
for pregnancy or STDs alone, or just both?
Both.
Okay. And then when you have sex, is it oral, vaginal, anal?
Vaginal.
Okay. And then no to the others. As far as like recent travels, have you traveled anywhere in the past year or outside the country?
Not outside.
Okay. Do you smoke?
No.
And no tobacco use at all? Or okay.
No.
I know the kids sometimes these days are using those jewels and chewing tobacco. Do you drink any alcohol?
I I do.
Okay. How often do you drink?
Once or twice a month.
Once or twice? And then is it just like a glass, like
Yeah,
a normal
sugar,
size?
glass of water.
Okay. Do you use any recreational drugs?
No.
Okay. As far as your diet, like your typical meals, like what do you eat? Do you eat a lot of junk food, fast food, or try to eat healthy?
Pretty much healthy.
Okay. Like lots of vegetables and lean protein. Good. Do you consume any caffeine at all through coffee or what have you?
Very seldom.
Like once a week, probably, you'd say.
Yeah.
Okay. As far as like exercising goes, are you exercising?
Yes.
Okay. What do you do for exercise?
Normally yoga, Pilates, about
Okay.
half an
Pilates, half an hour. How often a week do you do that?
hour. Almost every day.
Okay. Very good. As far as your last like health visit with a primary care doctor office, when was that about?
About a year ago.
A year ago. Okay. And then when was your last pap smear?
About a year and a half.
Okay. And everything came back normal, or nothing abnormal came from that, correct? And then when was your last breast exam?
I do it monthly.
You do it monthly? Okay, very good. And then as far as like your menstrual cycles, is there anything that's been irregular with that, or are you?
No, pretty regular.
Okay,
Yeah, I get it once a month.
okay. No changes in that. Are you having any symptoms today?
No.
Okay, very good. So next I'm gonna start your physical exam here, okay? So just some general questions, Miss Thu. Any fevers, weight loss?
No.
Okay, weight gain that you noticed recently? Have you been lethargic or tired?
No.
No chills or anything? Okay. And then have you noticed any like deformities or abnormalities like at all?
No.
Okay. So I just want to kind of take a quick glance at like your overall skin here. And then can you stick your hands out like this? Just want to make sure you got good refill, which you do. Okay, and just kind of, very good. And then I'm just going to take kind of just a look at your overall hair distribution, which looks good. No patches or thin, sorry, I'm just gently touching to make sure. Alrighty, and then I just want to kind of feel your arms, make sure they're warm.
Okay.
Okay, looks good. I just want to ask some quick general questions about your eyes. Any vision changes that you noticed lately, discharge, redness, irritation, dryness, or anything like that?
No.
Okay. So next, I want to just kind of take a look at your eyes here. Okay, and then if you want to look downward, and then I'm just going to kind of lift up your eyelids. Okay, I'm sorry.
Yes, sir.
Good. Okay. Very good. I'm just checking your eyebrows out here real quick. Make sure and they look good. So next I want to have you cover your eye, and I'm going to have you just let me know when you start to see my fingers move, okay?
Yes.
Okay.
Yes. Yes.
Okay. And then keep it covered.
Yes.
Okay.
Yes.
Okay.
Yes.
Very good. And we'll do the other eye. All right.
Yes.
Okay.
Yes. Yes.
Okay.
Yes.
Okay.
Yes. Yes.
Good. All right. So next, I'm going to have my finger here, and I want you to look at it. I'm just going to bring it slightly close to your nose, okay? Good. All right. And then I want you to follow my finger now. Good. Good. Just going to go slow. Good. Good. And then I was going to ask, no like light sensitivity or anything like that. Okay. So next I just want to shine this light in your eye here, okay? Just gonna go, yep. Good. 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 Alright. And then I'm just gonna kinda take a peek into both your eyes, okay? Good. Now I just want to kind of check out your ears. Have you had any hearing loss or hearing changes that you notice, or any pain or dizziness or anything like that? Okay, so I'm going to look on your left side here. Very good. I'm going to just take a look all around. Good. And then just good. All right, and I'm going to come on the other side here. Good. 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 No pain or tenderness when I was touching or anything like that. Okay. And then I just want to take a peek into your ears here. I'm just checking into your ears, making sure that your tympanic membrane's nice pearly white gray, which it is. And I'm going to check on the other side here. Good. Gray and pearly white and intact. Next, I just want to take a look at your nose. No issues with smelling or sinuses acting up or anything like that, correct? No. Okay, and I just want to kind of take a peek here. I'm going to go up a little bit higher. Good. All right. And then I was just kind of, we call them turbinates, or that's what I was like assessing for. And yours look good. All right. And then you haven't had any mouth complaints like bleeding gums or excessive, like increased like sensitivity or pain?
No.
Okay. Can you say ah for me real quick? And can you stick out your tongue? All right. Your tonsils look good. They're 2+ in size. All right. Okay. So next I just kind of want to assess your neck here and just kind of feel for any lymph nodes that might be enlarged, any tenderness.
No.
Okay. All right. And then I just want to kind of have you swallow here real quick. Very good. And I'm just checking your thyroid to make sure it's not enlarged or anything. Can you swallow again? Very good. Next, I'm just going to kind of assess your chest here. And like, you don't have any shortness of breath, chest pain, or numbness or tingling or any kind of symptoms regarding those. Okay. And then I know nurses, they get their TB tests checked up. Is your last TB good? How recent was that?
Less than 6 months ago.
Okay, very good. So I'm just going to kind of take a listen here. Very good. Okay. Just take a breath in. Good. 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 Sorry. Good. Good. Listen on your right middle here. Good. And I just want to take a listen to your back. I'm just going to kind of gently move your hair here. And same thing. And if you get dizzy or lightheaded, just we can take a break because I know huffing and puffing. Good. 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 So I'm also going to auscultate for any abnormal sounds here. Good. Good. Very good. All right. Next, I'm just going to have you breathe normally, and I just want to listen to your heart sounds here. Good. 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 And I'm just going to gently touch here. I just want to kind of make sure I feel PMI. Good. Right. So next, I'm just going to gently touch your neck again. I just want to make sure your pulses are good in your neck. I'll do one side at a time. If you get lightheaded or dizzy, just let me know, okay? Good. Good. And then I just want to take a feel of your wrist here. Good. All right, and then I'm going to check your pulses down in your toes. Good. And I'll just take these off for a moment. I'll put them back on.
Okay. Sorry.
You're okay. I just want to check down here. Good. Have you had any issues with like burning in like your urine, any like bloody urine or anything like that?
No.
Okay. And then do you feel like you're drinking enough fluids, like oral?
Yes.
Okay. Okay, Sue. Next, I just want to kind of check out your stomach and make sure everything's going okay down there.
Okay.
Any like nausea, vomiting,
No.
diarrhea,
No.
changes in bowel movements?
Pretty normal.
And they're like once a day,
Yes.
about round, formed?
Yes.
Okay. And no stomach pain or anything like that?
No.
Okay, so I'm going to have you lay down first. And then I'm going to take a listen to your stomach. Good. 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 Breathe normal for me, okay? I just want to listen up here. Okay, no worries. Right. And then next I'm just going to kind of gently touch, like your stomach. Let me know if you have any pain, okay?
Okay.
No pain or anything like that. Okay, and then I'm just going to go a little bit deeper. Same thing, any pain?
No.
Very good. Good. So I'm going to have you sit back up then. I can bring this guy up for you. All right, Miss Stu. So next, I just want to kind of assess your neuro status. Any numbness or tingling or anything like that? Loss of sensation anywhere?
No.
Okay. The medical assistant told me already that she did a visual acuity with a Snellen chart, and both your eyes individually and together came back 20/20 with your corrective lenses. And so next, I just want to do a couple quick tests. So first, I'm going to have you follow my finger. Good. 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 Okay. And then next, I'm going to have you just smile for me. Good. Okay. And then I'm going to have you clench your teeth. And I'm just going to kind of touch your face here. Very good. Okay. And then can you push your tongue against your left side? Good. Right side? Good. And then next, I want you to puff out your cheeks. Just good. And then can you raise your eyebrows like that? Very good. All right. And then I want you to shrug your shoulders. Good. And then can you swallow for me? Very good. And now I'm just going to have you repeat what I say. Apple.
Apple.
Good. Peach.
Peach.
Good. Next, I just want to kind of check some more tests out. I'm going to have you stand up here, and then I'm going to have you just walk normally. Very good. And then you can turn around. Okay, and then I want you to do that one more time, but try and walk in a straight line, just head to toe, or heel to toe, so I apologize. Very good. Okay, and then back, and we'll get you back up on the table here. Okay, so next I'm just going to kind of gently touch down here, and you just let me know if you can feel it, okay?
Yep. Yep.
On my right side?
Yep. Both sides.
Okay.
Left. Right.
Okay. Oh, sorry, I'm going to go by your abdomen.
Okay, both sides.
Okay.
Left. Right.
Okay.
Both.
Good. Okay. Next, I just want you to kind of do this like finger exercise with me. So I'm going to have you touch your nose and then touch my finger.
Okay.
So we'll, good, 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 good. Okay, and we'll do your other hand too. Good. Very good at this.
Oh,
Sorry, just 2 more.
okay.
All right, and then I just want you to do another thing, just kind of go back and forth like that for me.
Okay.
Okay, very good. So next I just want to kind of check your reflexes here. So we'll start up with your arm. Thank you. And I'm just going to kind of gently tap there. Good. All right. And then I'm going to come back and do this arm. Good. All right. And then I'm going to go right here. Good. And then just kind of good. Alrighty. And then next I want to do this one up here. Just kind of relax the best you can. Alright, good. I'll do this side. Good. Sorry. Alright, and then I'm going to just gently kind of do the same thing down here. Okay, good. Alright, and then next I want to do your feet.
Okay.
Sorry. Alright. So I'm just going to kind of just have you relax. Good. Just checking your Achilles. Alright, and then, okay, good. Sorry, I know that feels a little awkward. Okay, very good. I'm gonna just do some muscle strength test, and like overall you haven't had any like swelling, any stiffness, redness anywhere that you're aware of?
No.
Okay, and no pain whatsoever?
No.
Okay, so I want you to lift up. Good. Can you push down? Good. Now kind of bring your legs up. Yep, forward, then back. Good. All right, and then I'm gonna kind of have you just grip my hands here. Good. All right, and then I'll have you go kind of like this, and then don't. Perfect. Good. Do you have any other questions for me at this time?
No.
Well, it was a pleasure meeting you today. I'll shake your hand. And then if you need anything, just let us know, okay?
Okay.